Hi guys, welcome back to my channel. My name is Filipa, and if it's the first time that you see my face, hi, please subscribe to my channel. If you already subscribed, thank you so much for joining me. Like I mentioned in my last video, I'm gonna talk about my experience about postpartum. So yeah, first I'm gonna talk about postpartum care. So in the hospital they will give you this. I didn't use a whole lot because it didn't burn, because I didn't tear outside. My tears were inside, so internal tears, so it didn't burn, but I use it to clean. When you wipe, don't wipe, just pad to dry the area and should be okay. Also, in the beginning when I came home, I used to use this kind of pads. They are like this thick probably, and it goes from the front to the back, and yeah, so I use those, and on top I would do a sandwich with those. This is the cheaper version of Tux. This is a cool and smoothing personal cleansing pads. They are pre-moisturized with witch hazel. They smell pretty good, and they give you like a fresh sensation down there, because I didn't use ice packs, so I used those. So I just put like 3 of them on top of my pad, and it was good. It was pretty good. And then this was probably the first, I would say, 4 weeks I was bleeding a lot, and then after that I was kind of more like a brownish color, so it was like less. So I would just take like a normal pad that you use on your period, and yeah, and then probably I would say 5 to 6 weeks postpartum, I would use just this one that is just a liner, because you just have like kind of like mucus, the one they have during your pregnancy, like a yellow liquid coming out of you. So just to not dirty my underwear, or you know, to not smell, because you can change, so then it's easier. I use just a small pack like this. Also, what I would do, I would take baths every single day, one time a day for sure, sometimes twice, and I will use this. So this is my second one. In the first month I used a whole one. This is from Walmart too. This is 4 kilos, the Epsom salt. So I use this with a hot bath that would help my engorged boobs and my pain, because I had a lot of bone pain. I still do when I have my period. I had my period once already, and the pain gets stronger when I have my period, when I'm ovulating, and when I'm like kind of squatting, and then my legs are more like, you know, like apart from each other, like you feel the pressure on the bone. I guess I'm like tidy down there, like the bone, and because I push a baby out, like the bones are still going to the right place. So yeah, but it was, the pain was hard because you don't say right. It's hard to feel a position that you like feel okay, you don't have pain, and walking hurts. And then sometimes it was hard to get to Naya fast enough, because I was like sitting in bed, and then if she was in her bed and I would need to get to her, it wasn't easy, because I would had to position myself and I was in pain. But my husband was home for 2 weeks, so that kind of helped a lot. But yeah, the thing is, you have to live day by day, because you don't really know when the pain is going away. Also, I forgot to mention, when I used to take my bath, after my bath, I used to take 2 Tylenols, so I would see like the warmth of the water plus the Tylenol would help me relieve the pain for like 2 or 3 hours. So yeah, but now I feel good. Another thing, it was to pee. Pee didn't hurt, like it didn't burn or anything. Like I said, I had internal stitching, now external. So I think, I'm not sure because obviously I didn't talk to a doctor. Well, I talked with a doctor about it, but my family doctor didn't see it. I was feeling like kind of a pressure, so it was almost like I had to pee and the muscle like open and release the pee, and then when it was like contracting back down, I would feel like a pressure, and that kind of hurt. It wasn't like so painful, but it was a pain that I didn't have before pregnancy or labor, and I didn't want to have that pain like for the rest of my life. So yeah, but when my last stage came out, I kind of feel like the pressure like kind of like fading away, and now it's totally normal. I pee just totally normal. Everything is totally normal. Let's talk about number 2. Doing number 2. For me, it wasn't difficult to do number 2. Again, because I didn't have exterior tearing, so I don't know if you had exterior stitches, it's painful to do number 2. For me, it was never painful to do number 2 after labor. Actually, it was hard for me to pee after labor. They try, like I said, I think I said in my previous video, it was hard for, they wanted me to pee, and for some reason I had like a lot of pee inside of me, but I couldn't pee. Like my bladder forgot to work, so they had to put a catheter in for me to pee. So yeah, so the first day after labor, I never pee on my own. It was with the help of a catheter and a nurse. But then I start peeing normal just with that pressure. So yeah, everything was normal. Oh, and with the pads I use nursing pads as well, because I was leaking a whole lot. So yeah, that's what I use for my postpartum. I want to do a video about postpartum depression or baby blues after, so I keep you guys posted, and thank you so much for watching. Bye.